all of a sudden, one day, we were confronted with the same problem that the world was confronted with. We didn't know what it was going to be, just like the rest of the world.
It seems as though we always respond in a positive manner after disasters. And this was no different, because I understood I couldn't do it alone. The board couldn't do it alone. The citizens couldn't do it alone.
We're so grateful for this community. They came out in the biggest ways to support. I mean, it was just really overwhelming to watch.
You can't do the work without having collaborative partners. You know, it's really vital. We work with the hospitals, we work with other healthcare providers, we work with civic organizations. We worked really closely with the school system.
Well, one of the things I say to people so often is we often talk about all of the challenges that COVID created, and it did create a lot of challenges, but it also created a lot of opportunities for us to be more engaged in the community. Since February of 2021, we've actually been having regular vaccination clinics right here in the community.
You have to prepare for having some of your staff that's going to be out sick themselves, or they have family members that are sick. But we were trying to provide services to the community the best that we could with a short staff. And so, you know, we were doing COVID vaccinations 5 days a week when we first got started. And we were trying to make sure that we were providing as many services as we could to the community with COVID.
You know, we adapted to operating in that environment, and because we had strong relationships with each other, strong relationships with our network of providers, and strong relationships with the families, and we were determined to build on those relationships and maintain them. You use different ways to communicate with people.
We did have to get creative with reaching our patient. So instead of the patients coming to events, we brought the events to them.
You know, we are a community space as well as a brewery. I mean, we host farmers markets here every other Saturday. We have pop-ups. We've done, you know, coat drives, toy drives, school supply drives. We had a COVID vaccine clinic at the brewery, which was great. That was sponsored by Calvary Episcopal Church and Thorn Drugs.
We're a part of the Black Community Vaccine Equity Coalition, which started in the midst of this pandemic, and it's a lot of local organizations, the health departments, representatives from the hospital, the OIC, a lot of community-based organizations that are just coming together to address the issues of COVID-19.
We owe it to our community to come together every day, and not just one day a year when a football team wins a game.
I think the network worked well. The communication network, that we were able to use the relationships that we had with churches and businesses and the providers to just keep current as the needs changed.
So the COVID-19 pandemic really shifted how we viewed what we do. There's no golden calf. And so that's a kind of a philosophy we've developed here, that there's nothing that we have to hold on to so much, even especially to the destruction of other dynamics, right? So if we need to pivot, we pivot.
The biggest shift was not having people in the building. For a long time, we operated virtually and trying to figure out what that space looked like. But one of the big things that we found were that even though we were at home, there was so much more anxiety and tension and stress and feelings from students and staff of being overwhelmed.
The pandemic snuck up on us. And so therefore, people had a lot of time to be alone and was isolated, and so mental health became the forefront.
I really feel that this pandemic has exacerbated the mental health challenges, not only in Princeville, but throughout the world. But I know it has placed a light on, it's not negative to seek professional help when you're struggling.
People are more able to discuss their mental health. In the future, I think more people will know the warning signs of when they're about to shut down or need that contact, because they've experienced it, and so they know what to expect.
We hosted listening circles online for students. We hosted workshops and things that with dealing with anxiety, how to cope with being alone, online bullying. We were able to create new positions. That was another shift. We did hire a school mental health coordinator to help really see what our needs were. We partner with places, Integrated Family Services, mental health. We now have a therapist in every school building, thanks to them and Yoderon. So we're really still pulling on our community partners to make sure we get this done.
I will say one of the things that I really do love about this idea of community partnerships, especially in relations to the schools or just the educational realm in general, is that it does a really good job of empowering the teachers. It empowers the students. It also empowers any other stakeholders inside of the school building. A lot of times when we go into the schools, we see all of these different programs and initiatives, and they run for a year or they run for 2 years and then they burn out, right? And people think, well, why did they stop doing that? And why did they stop doing this? Or why didn't this program work? A lot of times the key to those programs having longevity is this idea of them partnering up with community.
It is like paramount to involve community partnerships. We are not an island as an organization, and we are comprised of people from all over. And so we want to make sure that wherever they are, we're doing the best offerings for them. And so our partnerships included to Interfaith Food Shuttle. And so we know that there are people who are struggling with getting food and nutrients. And so when we wanted to figure out how to best support them, we went to a group that's an expert in food distribution and became a host site. And our members were volunteering to help make that function.
It's not enough that a student comes in and they get all of the academic needs that they need. I can have a student who's a straight A student, but I would never know that student is a straight A student if their basic needs aren't being met, right? So when I understand that I'm able to meet the needs of my students, both on a sense of belonging, but also in a sense of, oh, you're hungry, so let me come and give you something to eat, or, oh, you need glasses to see in the classroom so you can see my board, let's make sure we get you some glasses, or, oh, you need, your teeth are hurting, so let me take you to the dentist. So finding all of these like different things to make sure that we're, I guess, appealing to, but also meeting the holistic needs of our students. When we meet those needs, that plays a huge role in their educational success.
Each month we have people who walk here to get vaccinations. They ride the bus, they ride the bicycles. So I think it's important that as we do this work, that we go to where the people are, make things accessible to them.
The challenges were there before the pandemic, and the pandemic actually made those challenges worse. So, for a long time, we've had a very bad problem with childcare providers not making a living wage. The pandemic also made it very hard for people to come to work because they needed childcare themselves. Childcare centers were closed, but people needed them as essential workers. So people stayed open, but little by little, we've lost a lot of teachers. One of the things that I think has come out of the pandemic is an understanding of the inequities that are built into the system.
The vulnerable communities, the support systems need to be strengthened. Healthcare overall and caring for those that cannot care for themselves needs to still stay at the forefront, and putting those emergency plans in place for those that are underinsured or uninsured, or even those who do have insurance.
So community involvement in pursuing equitable healthcare systems is extremely important. We realize that every group or any individual that's focused solely on their work and not realizing the work going around them will be limited in what they can do and what they can achieve. And so if any organization is in an area and they're impacting the people in that space, they must have the partnership of the people when designing their systems. They have to be aware of the people. Everything from empathy interviews to collecting raw data, that you have to have a big picture in order to paint something beautiful.